So what we are doing is, in these states we work in with the below poverty line sector, we work in rural areas, and we train people on right to information, how to seek information from government officials about what is rightfully theirs. So if a person, for instance, has not received a below poverty line card which would help that person to avail certain services, we teach that person how to, we train them so that they can go to the government official and ask for seek information. You have to demand your rights. That is the only way to deal with corruption.
There's a scholarship program for the ultra-poor families. If they send their girl students to the school, they are provided a scholarship as an incentive. But we found that in those cases, even for the enlistment of the kids in that category, 25% of the people had to make unauthorized payments. And not only that, when they went to collect the money, scholarship money, about 50% of the money was deducted as a result of corruption. In the health sector, it's more or less the same scenario. We have nearly about 5,000 people who are all over the country who are working with GI Transparency International Bangladesh on a voluntary basis. And these people, most of them are youngsters. They engage, kind of establish or promote a bridge between the service recipients and service providers.
Desde Transparencia por Colombia estamos trabajando el tema del control social como un elemento fundamental en el tema del fortalecimiento de la democracia. Y ese control social a partir de entender cómo el ciudadano hace exigibles sus derechos en unos contextos locales y regionales, bueno, también nacionales. Estamos trabajando el tema con organizaciones sociales de base. Es el ciudadano que organizadamente en un territorio hace control social a programas, proyectos, políticas públicas que afectan su calidad de vida en escenarios fundamentales de cumplimiento de derechos como son salud, educación, agua potable, y tenemos unos escenarios también maravillosos como es el tema de la consulta previa de las comunidades afrodescendientes.
If you look at various surveys by Transparency International Zambia as well as the government surveys, they do indicate the extent to which medicines are not available in hospitals, as well as the infrastructure development has been derailed. We have bad roads, and in schools we have limited school materials. And one of the biggest problems has been that because of the limited resources, most of which are not accounted for, the government has not been able to expand the public service, for instance, to employ more teachers so that they should be able to educate more pupils to achieve high levels of education in our country, which is a key factor in achieving Millennium Development Goals.
You know, the traditional mode of an organization like us would be to criticize the government and point to problems. But we've also formed partnership with government institutions. We're involved with a number of efforts. We're involved with the Anti-Corruption Commission. As a matter of fact, we worked in the early days of the Governance Commission to help create the National Anti-Corruption Strategy. And it's under that anti-corruption strategy that the Anti-Corruption Commission was established. And we were part of the establishment of the Anti-Corruption Commission.
Only by having more transparency, more integrity, more accountability, I think it's a much better chance of getting economic and social development.
Where there is civil will, there will be political will. That's my view. So empowering communities is very critical and very essential in making them demand and hold leaders accountable.